Now, the Komfo-Anokye Teaching Hospital is investing 2.2 million cedis to establish an Assisted Reproductive Technology Centre to enhance its fertility services. The centre is expected to commence operations in the first quarter of 2021, which will help address reproduction health challenges in the country. Chief Executive Officer Dr. Oheneba says the hospital keeps investing in modern technology in spite of the impact of COVID-19 on its operations.
The Komfo-Anokye Hospital suffered severe operational and financial bruises in 2020 as a result of reduction in patronage during the peak of the COVID-19 pandemic. One person died and 356 of its staff were affected by the disease. Hikes in cost of medical consumables also affected the revenue base of the hospital. In the midst of this, the hospital is investing in new technology to address fertility challenges in the hospital. CEO Dr. Oheneba Owusu-Danso, at a Thanksgiving service and staff reception event, expressed delight at the hospital's progress in the midst of the pandemic.
Among the facilities that would commence operations in the coming year will be the 2,200,000 Ghana cedis Assisted Reproductive Technology Centre, funded through the hospital's IGF, to provide top-level specialist fertility services to the country. And it will be the only type of its kind in the public health sector in Ghana. 4 fertility specialists have already completed their training in South Africa, Australia, United Kingdom, and Ghana, among others, in readiness for the operations of the ART Center, which is expected to be completed by the end of the first quarter of 2021. The Korean Foundation for International Healthcare, KOFI, on the other hand, is assisting the hospital with funds for the procurement of specialized equipment and instruments and the training of surgeons, nurses, and allied staff in South Korea in readiness for the takeoff of the laparoscopy center by the middle of next year.
Meanwhile, the hospital has constructed a 47-flat building for junior doctors. Dr. Owusu-Danso is positive this will save the hospital the huge cost incurred in renting accommodation for staff.
This block contains 47 flats for our newly qualified doctors, those we call the house officers. We've had deficit over the years, and we've been renting accommodation for them at huge cost. We think that this will come in as a good reliever for us in terms of our expenditures, even though we have spent so much money to bring it on board. And that for the years ahead of us, for those who will be living here, we don't have to spend extra money in renting private accommodation for their comfort.
Management also revealed the hospital has computerized its clinical operations and patients' folders are no longer in use at the facility. Prince Apia reporting.